This is NNI Bites, Big Learnings, a podcast where fellow healthcare professionals converse about the latest on nutrition science. Join us as Andrew Prentice and Nandita Perumal share their knowledge and insights on nutrition during pregnancy and birth outcomes.
Welcome to our podcast, NNI Bites Big Learnings. My name is Andrew Prentice, and I'm Professor of International Nutrition at the London School of Hygiene and Tropical Medicine. Today, it's my great pleasure to welcome Dr. Nandita Perumal to talk to us about nutrition in pregnancy. Dr. Perumal's research aims to improve maternal and child health, nutrition, and neurodevelopmental outcomes by looking at the effects of adverse influences during pregnancy and how these affect a child's development throughout their life course. She's eminently qualified for this task. She holds an MPH and a PhD in epidemiology from the University of Toronto, a BSc in human nutrition from McGill University, and completed her postdoctoral research in the Department of Global Health and Population at the Harvard School of Public Health. And now she's currently an assistant professor at the Annales School of Public Health in South Carolina. Nandita, it's a huge pleasure to welcome you to this episode of NNI Bites.
Thank you. It's great to be here.
So today we're discussing your paper on nutrition during pregnancy and birth outcomes, which appears in a recent issue of Annales Nestlé. Now, I'll shortly ask you to share your advice and insights with what we hope are our main listeners, which are healthcare professionals, and talk to them about how they can best advise mothers-to-be to optimize diet and eating patterns. But before we go there, let's set the scene by talking about how we define adverse pregnancy outcomes. Tell us, how do we assess these in a newborn, and in particular, why do they matter?
That's really the crux of a lot of what we think about in nutrition. So when we talk about adverse pregnancy outcomes, we're really referring to any outcomes that are associated with an increased risk of either mortality or morbidity later in life that are directly related to pregnancy. And these can occur both in the mother as well as the newborn. In the newborn, adverse pregnancy outcomes are particularly related to the timing and size at birth. For example, for timing, we're often concerned with whether a newborn is born too soon, or as we define it, preterm, which is being born at less than 37 weeks of gestational age, or if a newborn is born too small for their gestational age, that we normally measure either using birth weight or assessing birth weight for gestational age in relation to a standard reference population. Being born preterm, low birth weight, or small for gestational age are all associated with an adverse set of outcomes later in life, including adverse cardiometabolic outcomes. So we're really concerned about optimizing newborn size as well as timing at birth. And in addition, previous data has shown that these are also associated with increased risk of mortality. So we really want to make sure that newborns are born at the healthiest weight and with the healthiest timing that is possible.
And this, of course, is important both in a low-income setting, which I know a lot of your research is in, but also in high-income settings. And perhaps we should chip in that more particularly in the high-income settings, there's also a risk of being born too big if you're the offspring of a diabetic pregnancy.
Oh, absolutely. That's exactly right. In high-income country settings, it's often the case that we're more concerned about excessive risk of being born too large for gestational age, either being born large for gestational age or macrosomia, which is being born at greater than 4,000 grams at birth. And both of these outcomes are increasingly associated with adverse long-term cardiometabolic outcomes. So we do want to optimize that as well.
Great, and we'll come to talk about weight gain in pregnancy in a second. But before we go there, let's discuss your advice, please, on how parents can best prepare for a planned pregnancy.
Parents can best prepare for a planned pregnancy by supporting their own health and well-being prior to conception. So some of this includes what one would consider common sense aspects of taking care of your own health. And this includes stopping smoking, limiting alcohol consumption for both parents, achieving and maintaining a healthy weight, And for moms taking preconceptional folic acid supplements that contain at least 400 micrograms of folic acid per day. And these are all practices to prepare and promote optimal conception and pregnancy outcomes.
And I like the way that you bring in the dad there. I mean, this isn't just down to the mum. Dads really have a role, and there's the possibility that the dad's diet, his smoking and his alcohol can have an effect on sperm quality, which some of our research actually is showing can have a lifelong effect. So it's both mums and dads. And you emphasized also the very well-known, but sadly not always implemented fact that mums should try and take preconceptional folic acid. So we then come to the exciting time when the mum, her pregnancy test turns positive and she's got that 9-month journey ahead of her. What would be your first advice in thinking about diet?
My first advice would be to follow the general rules of eating a diverse and well-balanced diet in pregnancy as you would in everyday life, or as would be recommended in everyday life. The World Health Organization guidelines note, for example, that a healthy diet during pregnancy contains adequate energy, protein, vitamins, and minerals obtained through a consumption of a variety of foods, including green and orange vegetables, meat, fish, beans, nuts, pasteurized dairy products, and fruits. That is verbatim from the World Health Organization guidelines, and I would suspect that most would agree that these are just good general practice in everyday life as well. And these guidelines are generally recommended by all professional societies and international governments in relation to optimizing diet in pregnancy.
And one of the watchwords there, because that's a list that not all mums will be able to achieve, of course, again, particularly in low-income settings. But I think one of the watchwords is variety. Make sure you get diversity in your diets. So we come on to weight gain. Now, you've published very important research into weight gain in pregnancy, and it's been my pleasure to collaborate with you on this endeavor where you've actually done all the hard work. Can you explain why a mother's gestational weight gain is such an important predictor of birth outcomes? And perhaps just start by summarizing what the recommendations in fact are for how much weight a mum should gain during a pregnancy.
Certainly. Weight gain in pregnancy is a sensitive measure of maternal nutritional status and a proxy measure for optimal growth of the maternal, placental, and fetal tissues. So it really is a sensitive measure that we use to understand how well the pregnancy is progressing. The guidelines for weight gain during pregnancy depend on both the maternal pre-pregnancy body mass index, and this includes, for example, whether a mom is underweight or normal weight, overweight, or obese prior to pregnancy. The most widely used guidelines are the ones released by the Institute of Medicine. And in these guidelines, they recommend that women who are normal weight, which is women with BMI of 18.5 to 24.9, prior to conception, gain about 11.5 to 16 kilogram of total weight during pregnancy. Now, that's a fairly wide range of weight gain. And for women who are underweight, the range of total weight gain that's recommended is higher. And the range is lower for women who are overweight or obese, which is basically based on the requirements that women have during pregnancy based on their pre-pregnancy BMI.
And those data, which I've looked into a fair bit, are based on some very large actuarial databases looking at what is the what is the weight gain associated with the best outcomes, both for mum and baby. And of course, what the weight gain consists of is the baby itself and what we call the products of conception. So that's the increased blood volume, placenta, and so forth, but also body fat. And here's where the difficulty comes for many mums, that they may eat too much and gain too much weight, which they can't get rid of. And that actually brings us on to our next point, which is there's this old adage about eating for two in pregnancy. But I think this is not really true, and if taken literally, would encourage that weight gain we just talked about. Can you explain why this is the case and maybe give some guidance about how much extra energy a mum actually needs?
That's absolutely true that eating for two is the old adage of eating for two is not really true. The requirements, the energy requirements that a mom has during pregnancy are dependent on both her pre-pregnancy BMI and her basal metabolic rate. Now, when we talk about energy requirements, we're really thinking about what it takes to maintain the general requirements for bodily functions, which is maintained by the basal metabolic rate. But in pregnancy, we now include the number of weeks that a woman is pregnant and what her pre-pregnancy BMI is. And these requirements increase gradually in the second and third trimester of pregnancy. And the first half of pregnancy being characterized by increases in hormone that maintain the pregnancy and influence metabolism. And then the second half of pregnancy being more reflective of rapid fetal weight gain. And so when we think about requirements for what a mom should consume for energy to support tissue deposition, and as you mentioned, the products of conception in early pregnancy, the requirements are quite low. They can range anywhere from 85 kilocalories of additional energy per day to 150 kilocalories of additional energy per day in the first trimester of pregnancy, to up to 250 kilocalories per day, or even more, depending on the maternal pre-pregnancy BMI and the basal metabolic rate for the individual person. What's important to note that is quite a bit of variability in what the energy requirements can be, and they depend on the context in which the mother is having pregnancy and are affected by the physical demands of daily common life, as well as the resource constraints. There's some evidence that shows that the physiological adaptations in pregnancy in resource-constrained environments that require less energy for healthy pregnancy outcomes than, for example, in a higher well-resourced environment. And so it's important to consider that there is quite a bit of variability there as well. Bottom line, however, is that energy intake above what is needed for rise in basal metabolism that occurs during pregnancy will be stored as excess gain in adipose tissue. And so this is what we worry about the most, particularly in high-income country settings where the risk of excess weight gain is greater.
That's great. So maybe to summarize that, it's about 10%, even WHO recommendation, which many mums won't necessarily meet, is about a 10% increase. So certainly not eating for two. Now, Nandita, the next point, I guess, would be to ask you your thoughts about, so we need this extra energy. What would be the optimal sources of a mum getting that extra energy?
Question. The optimal sources of extra energy that moms can find are generally thinking about our earlier conversation about diversity in diets being important. Often what's lacking in pregnancy are intakes of essential fatty acids. And so when we talk about essential fatty acids, we are really thinking about polyunsaturated fatty acids that are present in fatty fish, such as salmon, sardines, anchovies, and tuna, as well as in nuts and seeds such as flax seeds and soybean, that are important sources of energy because they're from fats that can support optimal neurodevelopment of the infant. We're often lacking in essential fatty acids, so if there is an additional energy needs, then those would be recommended. And it's important to note that no more than 10%, the guidelines recommend that no more than 10% of total energy should be from added sugars. So achieving a balanced diet with about 40 45 to 65% of energy from carbohydrates, a third from energy from primarily from fats, and about a third from energy from protein would be optimal. And there are various ways of including additional foods such as nuts and seeds and fatty fish to improve the quality of some of the nutrients that are usually missing in the average diet.
Excellent. Now let's have a few words about protein next, because sometimes mums are a bit anxious, how much extra protein do I need? Do they in fact need any extra protein, or will it naturally be supplied by most diets?
Protein is naturally supplied by most diets in adequate amounts. However, it may be the needs for protein do increase over the course of pregnancy. That being said, if there is an optimal, well-balanced diet with adequate amount of total energy intake from proteins, there really doesn't need to be much of a change over time in maternal intake of protein. The recommendation is slightly higher, and especially in the first trimester, it's only about 1.1 gram per kilogram per day that's needed in addition to what was previously recommended. So it's really not hard to get through diet alone.
I think that's great, and that does sort of reassure many mums. So my final question then comes to issues around micronutrients. So earlier you told us that you gave us advice to mums about healthy eating, about a varied diet diversity and things. So that would, if achievable, normally provide most of the necessary micronutrients. But I have a question for you. Are there circumstances in which you would recommend that mums could or maybe should take dietary supplements with micronutrients?
Certainly, there are circumstances where moms should, as we talked about earlier, in preparation for a planned pregnancy, take dietary supplements that contain adequate amounts of folic acid, at least 400 micrograms per day. And these are essentially to meet the nutrient requirements for neural development of the fetus. There are circumstances in which moms may not need to take any dietary supplements if they are in high-income country context, in a well-resourced environment, eating a balanced, healthy diet that contains all of the essential macro and micronutrients. Then they do not necessarily need to take other supplements, but the iron folic acid and iron supplements and the folic acid supplements are recommended by the World Health Organization. So taking those prophylactically for a planned pregnancy is important to meet the adequate needs. In low resource country settings where the diet may not be adequate, moms are recommended to either take iron folic acid supplements or take multiple micronutrient supplements, which have 15 additional micronutrients, including iron and folic acid, to support a healthy pregnancy and optimal birth outcomes.
Well, there you go, some very, very clear guidance. Thank you, Dr. Perumal, for explaining for us how really critical it is for mothers to eat well in pregnancy, and actually for their families to support them in achieving this. Let me end, as I usually do, by summarizing your key messages, which I've taken from your paper. So first, optimal nutrition during pregnancy is critical, arguably the most important factor to achieving healthy pregnancy outcomes. A balanced, diverse, and nutritious diet is universally recommended to meet the needs to maintain growth of the maternal, placental, and fetal tissues. Daily supplementation with iron folic acid or multiple micronutrient supplements, as we've just discussed, with iron and folic acid in them, is recommended in most low-income and middle-income settings, but can also be taken prophylactically by women in high-income countries. Most importantly, perhaps women should consume foods during pregnancy that follow a healthy dietary pattern and meet, importantly, without exceeding the higher energy needs for gestational weight gain and optimal pregnancy outcomes. Dr. Perumal, Nandita, it's been a pleasure learning from you, and I hope that our listeners will be able to convert what they've heard into some actionable advice for expectant mums. I wish you all the best for your future research, important as it really is.
Thank you so much for having me.
It's been a pleasure. Thank you for listening to this edition of our podcast, NNI Bites Big Learnings. Please subscribe through the NNI 365 app to ensure that you don't miss future offerings.
And that concludes today's episode. Thank you for joining us with Andrew Prentice and Nandita Perumal as we talked about nutrition during pregnancy and birth outcomes. We hope you enjoyed and learned from this quick discussion, fellow experts. Till the next episode.